All right, everybody, welcome back to Ask Dr. Barry. You know, seizure disorder is one of the most confounding things. And if really you look at history, epilepsy, convulsions, fits, can you only imagine back in the old days, just minding your own business or with, somebody, acquaintance or whatever, all of a sudden they just drop to the ground and start shaking. And it lasts for a minute or a few minutes. And then afterwards, they're a little bit drowsy and out of it. But then they come back to normal. You can only imagine in the days before there was health care and an understanding about what this actually was, how fearful it would be. You can imagine demonistic feelings or, anything nobody knew what caused that type of seizure or, once again, epileptic fit, convulsion. Point is, we know now it's an electrical generation of activity and a part of the brain that can prompt, right, that type of activity. It can be a petit mal seizure, as they're called, which is more of an absence type of episode. Sometimes they're focal seizures where just one part of the body is affected. But most commonly, most people think about a seizure as that grand mal, tonic-clonic movement of all the arms and legs type of seizure.
Yeah, but no, I wasn't. I was playing video games. You were playing video games. Hun? Okay, all right. Okay. Hun, it's okay. Excuse me, ma'am. Can you please pass me my sweater and my bag over there? It's okay.
Sure,
okay.
What happened?
It's okay. He has epilepsy.
Should I call 911?
And listen, people can die from seizures, but typically they don't. Usually people do recover with what's called a post-ictal phase, or a period of time afterwards where it takes a little bit of time to get back to normal. In the emergency medicine field, where I worked, of course, for most of my career, when a child would come in with a seizure, we were usually very happy when that child would have a fever, because typically that would be a febrile seizure. The ER doctor knows that when a child doesn't have a fever, or when an adult comes in with a new onset of a seizure, believe me when I tell you, we hold our breath until that CAT scan or that MRI comes back and it doesn't show a tumor or any other specific cause of the seizure, right? So when you do a scan or an MRI, if there's a mass or a tumor or some other congenital cause, sometimes the cause of the seizure is obvious, but many times there's nothing on that CAT scan or MRI, and then you have to do an EEG or other ways of seeing the electrical activity. This comes into play in the medical cannabis world because we know that, of course, medical cannabis has significant activity at the CB1 and CB2 and other receptor levels, right? And it's been known for many years, of course, that there is some degree of a suppression of seizures from cannabis products.
And tell me about your daughter's life before you gave her, medicinal marijuana, and after.
So if I rewind 9 months to last October, she couldn't really do much. She could barely sit on her own. She was still having seizures. She had been on 8 different medications, anti-epileptic drugs. None of them controlled the seizures. She was having massive subclinical activity, so it's basically like seizing constantly in the brain.
And how soon did you notice a difference?
Well, we started her on a low dose after I made the first batch of oil and got the lab test results back. The second day, she had a minor seizure. This was mid-November. And then after that, she has not had a seizure since.
Even a subclinical?
Nothing. We had her 17th EEG in January, and it showed no seizure activity at all. Nothing.
Wow.
But one of the most important things in the seizure world and medical cannabis is there's actually a DEA-approved drug, Epidiolex, that has gone through double-blinded research studies. It has now been approved, right, for the treatment of 2 pediatric seizure disorders. The reason that's so important is that we still exist under federal Schedule I designation in this country, right? So all the cannabinoids, not just THC, but CBD, which is what Epidiolex is, right? Not THC, but one of the other cannabinoids. Even CBD is not typically or allowable, right? And surely not research of CBD. So the fact that this has already occurred in the country, even under Schedule I, is just such a insult to doctors and patients, and it should be an insult to the general population, quite frankly, because when people know that there's such a insane, and I will call it insane, Schedule 1 designation of a substance that we know has helped people and in fact has already been approved by the DEA, it all needs to be unraveled. It cuts at the social fabric of society. So the important thing is for neurologic conditions like seizure disorder, like Parkinson's, like MS, we know that medical cannabis has effects because of that beautiful, unique endocannabinoid system, right? And once again, for seizure disorders, we need more study, but what we do know is that cannabinoids absolutely have positive effects.